In the healthcare system in Canada, we are lagging behind.
A new report from the nonprofit Public Policy Forum says all of Canada's health records should be made digital and accessible to all members of a patient's care team by 2028 to improve the system. The organization says the current handling of health records is out of date and is easy for information and referrals to get lost. The organization says doctors and clinics need to stop using fax machines.
This is 2024, not 1994, not 1984. Like, why are we still using fax machines?
Last year, Ontario's government committed to axing the fax by replacing antiquated fax machines with digital communication alternatives at all Ontario healthcare providers within the next 5 years. Dr. Kashif Prasada says it's extremely frustrating.
You send a fax, you hope that they get it, you hope that they respond, and you don't know if anything actually happens. You have to wait and pray, and it takes weeks for this to happen. And so a lot of stuff could get missed, a lot of stuff could happen, and you don't have any reliability in that system.
Winnipeg family physician Dr. Pravin Sagar Mehta says he went electronic with his patients' records back in 2012 and has worked well on his end, but with the system remaining outdated, he still has to use the fax machine to send out prescriptions, consults, and receive reports.
Way behind other countries in terms of digitizing our records and making it universal electronic medical records, which would be ideal.
Stephen Staples says making patients' records digital will improve the care, reduce wait times, and will improve the patient-physician relationship.
It's just a no-brainer, and it's something that the federal government has been putting money on the table for the provinces to get on board. It's just that some of the provinces have been dragging their feet on this.
Last year, Ottawa announced it's spending more than $200 billion over 10 years for provinces to improve healthcare. So far, only Alberta, BC, PEI, and most recently Nova Scotia have signed on to the deal.
Having access to your own health information, we know, is something that really helps us to navigate our own health, helps us to know what medications we're on, what we need to take, make sure that we're keeping track of lab test results, other information, and it can actually help to support safer care.
Dr. Kathleen Ross says this is a critical modernization step that the Canadian healthcare system needs to undergo.
It is critically important that we leverage our digital world to try and share information as necessary when we are seeking healthcare.
In Winnipeg, Alex Karpa, City News.